Hello everyone. Let's study the applied anatomy of Klumpke's paralysis. I am Dr. Komala N, Professor of Anatomy. All images and videos used in this presentation are from the textbooks of anatomy and various internet resources. The images used here are for teaching learning purposes only. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. Let's now look at a case. 4-month-old infant presented with complete paralysis of digital flexors and intrinsic muscles of the hand. Symptoms of Horner's syndrome were noted. Delivery was by the emergency cesarean section. Birth records revealed that there was difficulty during delivery. This is an injury to the lower trunk of the brachial plexus. The C8 and T1 spinal nerve roots are affected. The ulnar nerve and median nerve gets affected in such cases. This results due to undue separation of the arm from the trunk, as in clutching something while falling from the height or during the birth injury. There is motor loss to all the intrinsic muscles of the hand. The lumbricals, first and the second, are supplied by the median nerve. Third and the fourth lumbricals and the interossei are supplied by the ulnar nerves. The thenar and the hypothenar muscles also get affected. The flexor carpi ulnaris and the medial half of the flexor digitorum profundus are damaged. Normally, the lumbricals bring about the flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Whereas in such cases of the lower trunk injury to the brachial plexus, these lumbricals are damaged and hence there is presentation of the claw hand. There is hyperextension at the metacarpophalangeal joints and flexion at the interphalangeal joints, resulting in the claw hand. In such cases, we also can note the sensory loss along the medial side of the hand and the forearm because they are supplied by the C8 and T1. Also, in this picture, you can note there's damage to this part of the brachial plexus, the C8 and T1, due to hyperabduction as shown here. All the small muscles of the hand, or the intrinsic muscles of the hand, are damaged, resulting in clawing. Due to the involvement of the T1, the features of the Horner syndrome is noted as the sympathetic nerve fibers get affected. These symptoms are anhidrosis, lack of sweating, miosis, constricted pupil due to the paralysis of the dilatar pupillae. Ptosis is the drooping eyelid, loss of ciliospinal reflex, and inophthalmos, which are sunken eyes. Thank you for your patient hearing. Do subscribe, and your subscription will motivate me to do more videos.